All right, let's dive right in. We're tackling a topic that's been creating a lot of buzz lately: AI in electronic health records. And the exciting thing is, this isn't some far-off futuristic concept. It's already making waves in healthcare.
It's true, the landscape is changing rapidly. I mean, AI in healthcare used to sound like something out of Star Trek, right?
Right.
But now we're seeing tangible advancements, real-world applications that are already making a difference.
And a lot of these changes are happening within the systems that healthcare providers use every day, EHRs.
Exactly. Xpio Health, for instance, has highlighted some really compelling examples of how AI is impacting EHRs right now. Take predictive analytics, for instance. It's a game changer.
Okay, so when we talk about predictive analytics in healthcare, what are we really talking about? What does that look like in action?
Well, imagine this. An AI system analyzes a patient's entire electronic health record, sifting through mountains of data, and it detects a high risk for sepsis even before any obvious symptoms emerge. That early warning, powered by AI, gives doctors a critical head start. They can intervene sooner, potentially saving lives.
That's incredible. It's like instead of reacting to a crisis, it's all about getting ahead of the curve.
Precisely.
Are there other ways that AI is being used to unlock the potential of EHRs?
Oh, absolutely. Another major area is data analysis. We're talking about massive amounts of data that EHRs generate. AI can process and analyze this data on a scale that's simply impossible for humans.
So it's like having an extra set of like superpowered eyes scanning through patient records, looking for those crucial but maybe subtle clues.
Exactly. And what's really exciting is what this kind of analysis can uncover. We're talking about identifying patients at risk of hospital readmission, predicting the progression of chronic diseases,
Wow.
and ultimately leading to more informed, more personalized healthcare decisions.
This is amazing. It sounds like AI has the potential to really transform how EHRs function, making them more proactive and insightful tools.
Absolutely. And this brings us to another interesting point, how AI can address some of the biggest frustrations associated with EHRs today.
I think it's safe to say that EHRs, while incredibly powerful, don't exactly have the best reputation when it comes to user friendliness.
Yeah, user-friendly might not be the first phrase that comes to mind,
Right.
to put it lightly.
They can feel clunky, overwhelming, and I've heard from so many healthcare providers who say EHRs just add to their already overwhelming workload.
Absolutely. And that's a real concern because when systems are difficult to use, it takes away from patient care.
Exactly. It's like being buried in data, but still struggling to find the exact information you need when you need it.
Right. And then there's the alert fatigue, the endless documentation.
Yes, all of that. So, how does AI actually help with these pain points?
Well, Xpio Health points out that AI can address these very issues. Instead of just adding more features, it's about making the existing ones work better.
Okay, so less is more in this case.
In a way, yes. It's about smarter, not just more.
I like these.
For example, imagine an AI that acts as a filter for all the data in an EHR. So instead of being bombarded with everything, doctors and nurses only see the most relevant information tailored to their specific needs in that moment.
That makes so much sense. It's like AI cutting through the noise to help them focus on what matters most. But what about the documentation burden? I mean, that's a huge one for a lot of providers.
Absolutely. And that's where things like natural language processing come in.
Which is?
So picture this. A doctor's finishing up an appointment, and instead of spending the next 20 minutes hunched over a computer, typing up notes, they just dictate their observations directly to the EHR. The AI then converts that spoken language into accurate, detailed documentation.
Wow. So they can literally talk to the EHR and it understands. That would be a game changer for so many healthcare professionals.
Exactly. It frees up so much time for what truly matters, patient interaction.
Can I imagine that could also help reduce errors or inconsistencies in documentation?
Absolutely. And AI can even go a step further, like automatically generating summaries of patient visits, flagging critical information for follow-up, all while ensuring that everything is secure and, high-pay compliant.
That's incredible. It sounds like AI has the potential to not only address some of these really significant pain points, but also enhance the overall functionality of EHRs. This all sounds incredibly promising, but I imagine integrating AI into these complex EHR systems isn't exactly a walk in the park, right?
You're hitting the nail on the head. It's not as simple as just plugging some new software and calling it a day.
Right.
Xpio Health really emphasizes that successful implementation is key here. It's about strategically integrating AI into the complex ecosystem of a healthcare organization, and that comes with its own set of challenges.
So what are some of those challenges? What makes this integration so tricky?
Well, for starters, you've got the sheer complexity of these systems. We're talking about a web of interconnected technologies, different departments, established workflows. It takes careful planning to make sure AI integrates seamlessly without disrupting everything else.
It's like trying to weave a new thread into an already intricate tapestry.
Exactly. And that's why Xpio Health stresses the importance of customization and optimization. It's not a one-size-fits-all situation.
So it's about finding the right AI tools and then tailoring them to fit the specific needs of an organization.
Precisely. You need to look at the organization's unique workflows, their existing data sets, the specific challenges they're facing. And even then, it's an ongoing process. You need to constantly monitor, refine, and adapt the AI system based on real-world data and feedback from the people using it every day.
That makes sense. It's about making sure that technology works for the users, not the other way around.
Exactly. Because ultimately, the goal is to leverage AI to improve patient care. And that requires a thoughtful, well-executed implementation strategy.
It's amazing to think about the potential impact here. It feels like we're on the verge of a real paradigm shift in healthcare, with AI playing a central role.
Absolutely. But as we continue to explore these possibilities, it's crucial to remember that AI is a tool. Its success hinges on our ability to implement it responsibly, ethically, and in a way that benefits both patients and providers.
It's a powerful reminder that with great technological advancements comes great responsibility. Well, this has been an incredible deep dive into the evolving world of AI and EHRs. Thanks for joining us as we explored the potential, the challenges, and the importance of optimization and harnessing the power of AI in healthcare.